You realize you're not in control anymore, and other people are in control of your fate. You know what? As of this moment, I'm no longer a doctor. I am a patient. I'm a patient. I did not want to believe that I had pulmonary embolism. I was in denial, and I tried to make excuses about why I was feeling so short of breath, why I could not work, why I couldn't function that day. And there was a lot of fear that was pushing away the reality of the situation. But, you know, the echocardiogram was done, and I realized that this could be something that killed me or something that gave me lifelong morbidity with pulmonary hypertension.
Dr. Raoli has been a very good friend of mine. We met each other in Miami over 10 years ago, and when you have one of your closest friends telling you that they have, you know, what we call submassive or intermediate risk pulmonary embolism, I mean, it scared me. And then when he tells you, hey, listen, I want you to treat me, it's also a little bit of a burden as well.
He came up to me and said, listen, you know, I have to ask you, how would you like to be treated? And I said to him, you know, I'm here to be treated with the Inari retriever catheter because I've done this procedure many times. So I know what happens to patients, and I know what kind of results can be gained. And I know that if I don't have this obstruction relieved immediately, I'm going to suffer long-term effects. I had spoken to the technologists in the room, and I had told them that I want to see the screens as the procedure was going on.
So apparently my nurse had actually put one of the monitors right in front of him, and he's watching the procedure the whole time.
There was one moment in particular where the catheter was going up through my pulmonary artery and was being moved to my right pulmonary artery. It's one of the trickiest movements to make with this device. And I said to him, oh, that was a really good move, Dr. Gandhi.
And I'm like, well, you're watching?
From the moment the anesthesia went in until the moment I was out of the room, I honestly never felt a single uncomfortable moment.
He actually had a follow-up scan a couple months after we did the treatment, and there's no clot left, which is really a remarkable result.
My heart looked completely normal. There was no obstruction, no long-term effects. I have tremendous respect and appreciation for him. And the fact that I could be there for my family is a miracle to me, and it makes me extremely grateful for the device and for the doctor.